Okay, let me start my screen share now.
Okay.
Yeah.
Hello, everyone. Welcome to today's webinar. Before this great discussion focusing on hyaluronidase, please be with us from now on. We have already had a new official website in addition to the previous Facebook group. And in the next few days, we will post all archives of previous webinars in May, June, July, and August. And please visit sciencehr.org and register after this webinar. Patrick Huang, currently the president of SciAsia. I'm also in charge of the education in dermatology and skin surgery in Taiwan. And I'm so happy that we will focus on the clinical use of hyaluronidase today. And today we have some great speakers from Asian Pacific area. So I will introduce them afterward. But today I'll be the first speaker to share some update information. So today's webinar is especially focusing on the use of hyaluronidase in vascular accidents. And I have no conflict of interest with commercial interest.
Patrick.
Okay. Okay. Good. Sorry to interrupt, Pohan.
Yes. Yeah.
I will now.
It's your turn
share
now.
my screen. Yeah. So, continuing what Patrick had explained clearly, this is more into the practical experience and recommendation of hyaluronidase injection for managing filler complication. Sorry, I need time to do my next slide. Okay. So, I'm a dermatologist from Indonesia, and this is a non-sponsored lecture, and everyone here is actually just keen to share our knowledge and experience for other doctors to learn together.
So, Dr. Xu, please.
Okay, thanks for Juan's kind introduction. And it's my pleasure to be here. And today I'm going to share with you the case with vascular occlusion. Okay, so we have to inject as much as possible, and maybe 1 or 2 times to finish the injections of hyaluronidase. Okay, this is my case.
So why don't we start another presentation? You want to do it first, or Joyce? Joyce, are you with us?
Yes. All right, I'm going to.
Yeah, thank you, Joyce.
Okay. Okay, I'm going to talk about 2 patients, 15 years apart, and it's more for discussion on the diagnosis as well as the discussion on the treatment or management. It may interfere with the activity or the effectiveness of hyaluronidase. Okay, so I open this for discussion.
Okay, thank you so much for your presentation. It's very interesting because most of the injector, they will see early case, but because of your expertise, I think all the injectors try to refer patient to your office. Peter, are you with us?
Yes. Okay, I'm going to share my screen now.
Peter, you have to unmute yourself.
Yes. Okay, unmuted, right? Can you hear me? Can you see my slides? Can all of you see my slides?
Yes.
Okay, right. So, okay. So I find that difficulties in presenting this talk is because there are lack of clinical studies. Because most of the time, all these patients are private patients. They are cash paying, and lack of reporting because we are worried about litigation. So even there'll be this, although the number of cases we know are high, but it's just lack of reporting. So there's no clear guidelines as to how much to inject and where to inject. I think it's not a very objective study. It's not a large scale study, right? So when I look at this topic, do we want to inject hyaluronidase? Let's look at if the complications happens minutes to hours. If it's bruising or hematoma, within minutes and to hours, we can see that it's bruising or hematoma. If the patient is on oral anticoagulants, the risk of having the bruising is higher. And if we inject at the wrong plane also, the risk will be higher as well. Non-inflammatory nodules due to overcorrection. This is very straightforward. We know that we over-injected and then we see the nodules. Obviously, it is just hyaluronidase. There are cases of anaphylaxis due to hyaluronidase, but it's really rare. So, observe for 60 minutes after injections. Yeah, with that, I thank you.
Okay. Good evening, my friends. I would like to share with you this case with whom I actually learned something new. Could it be that somehow hyaluronidase is able to change calcium hydroxide apatite or any of its component in the filler in the consistency for that? But in the future, in the unfortunate event, if you have no better choice, if you have nothing better to do, maybe this is what you can try even if the filler was not HA. Thank you.
Well, thank you so much for all the speakers joining this webinar, and I look forward to everyone's attendance in 2 weeks. And Peter, thank you so much, and Joyce, thank you for being with us this time, and I also appreciate Dr. Xu Nairen, Zheng Banwen for the first. Dr. Zheng is the second time to join us, and Dr. Xu is the first time to join us. And definitely we'll invite more speakers in the future to join the big family who will devote ourselves to the education, online education in skin surgery and aesthetic dermatology. And thank you so much for your attendance tonight. Thank you. Good night.
Night.
Good night.